we'll be canceling smoking cessation. So this can be given in exam. So canceling, smoking canceling. Canceling smoking addiction. So it's also a very high canceling topic. We should be able to cancel any addiction. There's alcohol addiction. There's some other addictions. So for this, don't forget the acronyms for canceling in general is GATHER. Please, I repeat again, I won't go through the G and the A part. G stand for greet and A stand for ask. So if you still want to know the G and the A part, you can go through the introduction video. So I will start from the tell. But before the tell part, immediately before the tell, there's something you need to also ask from this patient. There's some basic question you need to ask from this patient. So what are the questions you want to ask? You want to ask the patient if he's a smoker. Obviously, the patient is a smoker, so you might necessarily not ask. So you want to ask, what do you smoke? What do you smoke? I want to ask this patient first. So most likely the patient will be smoking cigarette. Are you hearing me, doctor? Can you hear me?
Yes. Yeah, I can hear you
Okay,
very well.
most likely the patient will be smoking cigarette. So you want to ask, how many packs of cigarettes does the patient smoke? How many packs do you smoke per day? Let's see. Okay. So after that, you want to ask, do you have any behavioral associated with smoking? Do you have any, let's say, behavior associated smoking? Okay, or any illness, to be illness, okay, or illness. So the patient will tell you. Please, this is very important, doctors. Please, you should need to ask some of these questions, and you can ask your cage questions also. Your cage we ask in alcoholisms, so you can ask your cage question. So what do you mean by cage? The C, excuse me, the C means, have you ever felt the need to stop smoking or any urge? Have you ever felt the need to stop smoking? Okay, that's very important. Then you want to ask, have you gotten angry about what people say about your smoking habits, or do you get angry about what people say regarding your smoking habits? Okay, so the next thing is guilt. So you want to ask, do you feel guilty cause of the way the person smoke? Do you feel or do you feel guilty cause of the way smoke? And the E is more of like a eye opener. You could also ask it. So you want to ask the patient, do you wake up in the morning and the first thing you do is to smoke? Do you wake or do you smoke? Do you smoke first thing in the morning? So this is cage. Mostly this cage, you use it when you are actually doing your alcoholism, but you can also ask it. But please, these first questions are necessary. You want to know what the patient smokes, how many packs the patient smokes in a day, and does the patient have any behavioral associated with smoking or any illness? Please take note. So after the whole thing, you want to start with your tell. So these are the things you do first. before you move to the T part. So we are going to start with the T part now. So for the T, which is tell, T means tell. So you tell everything starting from definition. So what is smoking? So you want to give a very simple and precise definition. So smoking is, let's say, the act of inhaling and exhaling. Exhaling, let's say, smokes or fumes. So exhaling, hold on, exhaling smokes or fumes. It can be from plants, it can be tobacco, anyone. Fumes, or let's say tobacco or drugs. Drugs could be any plant material. Please take note.
Okay.
Plant material. I even learned some people even smoke tire. You are aware of that, doctor? Eh?
Yes. Yes.
Yeah, people smoke tire. People smoke a lot of things.
Rubber. Yes. So the rubber from tire, yeah.
So that's why it's important to ask what the patient smokes. So you want to explain to the patient smoking is act of inhaling and exhaling smokes or fumes or tobacco or drugs, anything. Okay. So you have to also explain the reasons why people smoke actually. So what are the reasons for smoking? People smoke because of so many reasons. And one of the reasons is actually very common is peer pressure. Because you see your friends smoking or your friends would ask you to also try and smoke. So those could be one of the reasons. Maybe family history of smoking. Family history. If you are from a family where they smoke, your brothers, your uncles, or your siblings are smoking, you might also be at risk of smoking later in future. And some people is just to satisfy curiosity. To satisfy curiosity. Some people used to say it's curiosity that kills the cat. Is that is true? So some people just feel like, people have been talking about this, people have been talking about this. Let me also try it one day. So they will try smoking. So some, it could be a role model. Maybe they have somebody they are looking up to. Maybe somebody like, maybe you see Naira Marley smokes. Naira Marley is your role model. You might want to smoke also. So people smoke for so many reasons. Maybe Bob Marley is your role model. Or maybe just all this bad orientation. Let's just say bad orientation. People have different orientations. So apart from that, maybe things like recreation. Some people just like, during recreational time, they smoke different things, shisha and all those things. So these are reasons why people smoke. So you have to explain to the patient. There are other reasons, but this is enough. You don't have much time. You only have less than 5 minutes in that station. So you need to do very fast and move. You understand, doctor? So the next thing you want to talk about is the reason to quit smoking. So what are the reasons to quit smoking? So you have to let the patient realize like, this smoking habit too, if you stop it, it has some certain advantage. One of it is you live longer. You live longer. It's very important. Apart from that, you save your money. You save money. So you don't spend your money on tobacco, on shisha, on different things, on marijuana and all the rest. And apart from that, the person looks more better. Looks better. The person smell better and nicer. Please take notes. The person will smell better. The person won't have all these smell from smoke. You understand?
Yes.
So it's also very important. Apart from that, also it improves the sexual drive actually. So if you quit smoking, your sexual urge, it improves, let's say, your sexual life. You understand? And apart from that also, it improves your brain function. Improve brain function. Are you getting me? So there are so many reasons why you need to explain to the patient why they need to quit smoking. So this is enough. Okay. So after
Yes.
explaining this, you need to talk to the patient the types of smokers. There are different types of smokers apparently. Doctor, you remember now. There are different types of
Yes.
smokers. We have what
Yes.
and
We
what?
have the active one and we have the passive smokers.
Yes, we have active smokers and we have the passive smokers. So you want to talk about the classifications of smokers. Classifications. So for under the classification, we have the what? The first set of people who are called the active smokers. So who are the active smokers? You want to explain also? So active
Yes.
smokers are
The ones that
they,
smoke directly from the
yes,
source.
they smoke directly, absolutely, directly from, let's say, the source. So they put it in their mouth directly and they smoke it. You understand? Why the other types of smoker we have is the passive one. Passive smokers, those that are staying around people that smokes. Let's say those that stay around the active smokers. So those that stay around the active smokers are referred to as the passive smokers, and both of them have different, the same risk factor. Even sometimes passive smoker even that can be affected a lot. You need to explain this to the patient. So the people around the person is at risk. People like the children that are living around, they are at risk. Even apart from that, the wife, if the person smokes around the wife, the neighbors also at risk. It is so the people in the community also. Are you getting me? So these are
Yes.
very important. So you need to now explain to the patient risks of smokers. If you continue smoking, the person is at some certain risks. Are you getting me? So you
Yes.
need to explain the risks to the patient, that the risk that the patient is at. So let's talk about the risk. Risk of smokers. They are prone to some certain disease, and it is believed that most of cancers, actually, smoking is actually related to them. Do you understand? Talk of the cancer of the lungs, person that has risk of cancer of the lung, cancer of the lip, person is at risk of cancer of the lips, stomach cancer, colon cancer, even bladder cancer, etc.
Mm-hmm.
Bladder cancer. So they are at risk of all these things. So you have to tell the patient, you have to explain to the patient they are at risk of all this. Apart from that, chronic lung disease, chronic lung disease, things like your what? COPD, even asthma, they can aggravate asthma. So please take note, even asthma.
Yeah.
So apart from, hold on, let me pull it in up. Apart from this, also your what's it called? DM, your DM, people are at risk of DM also. DM. Apart from DM, things like problem in pregnancy. Problem in
Goodness.
pregnancy. So you want to advise the what's it called? The father, if he smokes, to stay away a bit from the pregnant mother, because they are also at risk. So you want to give different complications during pregnancy. You understand? So
Yes.
some vascular disease, so at risk of different vascular disease that affect the vessels, even thrombosis also, thrombosis and all the rest. Even very important, cardiovascular disease. Please take note. Cardiovascular disease is very important. It can cause risk to cardiovascular disease. And apart from this also, it can affect gums infection, gums infections. It can cause bronchitis and so on and so forth, doctor. Bronchitis, etc. But these are very important. So you see how dangerous this thing could be. You see how dangerous somebody who smoke could be. So you have to explain the risks. These are risks for someone who smokes. So you have to tell to the patient. So and after explaining all this to the patient, you also need to explain to the patient on what to do if the patient is ready to quit smoking. So the other part we're going to talk about is quitting smoking. Do you understand? I believe you understand everything I've explained here, doctor.
Yes.
Okay, this is very short, and it's always good when you make it short and very fast because you don't have time that day. So the other part is quitting. First, what would the patient do? You are helping the patient here. So quitting smoking, quitting. So what are those things to be done? So first, you have to do. The patient have to be determined. Determination is the first thing. So the patient, are you ready to quit? Set up a specific date, and the next thing is to identify the triggers. Triggers. What are those things that makes you to go back to that smoking? Is it your friends? Is it one role model you are following or something? So you want to identify what triggers. Then you get a counselor, which will be you in the hospital. So we'll be coming here, we'll be counseling you regarding this is very important. So a counselor is there. Then don't forget to tell the patient about some certain drug, the NRT, nicotine replacement therapy. Okay? That will also
Yes.
be given. Nicotine replacement therapy. An example is this your bupropion. Bupropion is given. Please take note. And when do they give this bupropion? It's given
1 to 2 weeks.
yes, 1 to 2 weeks before the stop date, before the date that the person has determined, like, oh, at this time I'm stopping smoking. So you give bupropion 1 to 2 weeks. That is given, let's say it's given 1 to 2 weeks before stop date. Okay, so that's that about that. So the next thing is you also need to explain to the patient the possibility of withdrawal syndrome because sometimes the patient might still feel like going back to that smoking. Do you understand?
Yeah.
The patient will actually have the urge like, oh, I still feel like going back to smoking or trying to smoke or something. There's high chances. So you need to explain some of the symptoms the patient might probably experience during this whole procedure. Are you getting me? So
Yeah.
explain the possibility of withdrawal withdrawal syndrome. So withdrawal syndrome, patient might begin to experience some certain symptoms. You understand? So you tell them like this is just a phase. You try to empathize with them. Like this is a phase. It will definitely pass. Do you understand, doctors?
Yes.
So what are those things the patient might be experiencing during this place? The patient will be experiencing like urge to smoke. Even the urge will be so great, like be like just one. So urge to smoke, increase appetite, increase appetite. Then might experience things like let's say depression. Depression. When I go into depression, then might become just waking up at night. Let's say awakening, night awakening, poor concentration, concentration. Okay, and maybe lightheadedness or light headache, light headache, etc. Okay, these are the symptoms of withdrawal syndrome. So it's just
Yeah.
more like a phase, and there are drugs that you can give during this phase, your diazepam. So you want to explain all this to the patient. Do you understand? So
Yeah.
after that, you ask the patient if you understand everything you've explained, if the patient can retell, then book the patient for a follow-up, set a due date, and that's it. You see, it's very short. It's actually very short. It's not long. You understand? So
Yes.
smoking counseling is very short. Doctor, do you have any question regarding
No.
this counseling?
No. I was just surprised that the cage questions are used for smoking too.
Yeah, you can. I think you can use it.
Okay.
Yeah, you might not
Yes.
necessarily because it's more like an addiction. Addiction.
Okay.
You understand? It's more like an
Yeah.
addiction. All right. So in the absence of no question, I guess that's all. So for
Yeah.
those that will be watching this video subsequently, don't forget to comment, like, and share. If there's any question, don't forget to ask. All right.